Ozempic versus Mounjaro by Jessica Kerman. The rate of GLP-1s, primarily Ozempic and Mounjaro. GLP-1s have been all over social media, from TikTok, Instagram, even news outlets. Everyone's losing weight with these GLP-1s, according to mainstream media. Now, you can be scrolling, just seeking entertainment, and you will still be met with conversation on Ozempic and Mounjaro. Some may even accuse celebrities or fitness influencers of using these GLP-1s, Ozempic and Mounjaro, to lose weight but hide it from their audiences. We will focus on the similarities and differences between Ozempic and Mounjaro, particularly main active ingredient, how they're used, benefits, and side effects. What is Ozempic? Ozempic is an FDA-approved treatment for type 2 diabetes. Another name for Ozempic is semaglutide. Semaglutide is Ozempic's active ingredient. Ozempic affects GLP-1 receptors only, increases insulin production, improves blood sugar levels, and is injected once a week. Ozempic increases insulin production levels by telling the pancreas to make and release more insulin. Ozempic is injected once a week. The dosage starts at 0.25 milligrams once a week for about a month. And after that month, the dosage can go up. However, the max dosage is 2 milligrams. After that, there's no more of a higher dosage. However, Mounjaro is a little bit different. Mounjaro is also an FDA-approved medication for type 2 diabetes. However, its active ingredient is tirzepatide. And Mounjaro not only acts on GLP-1 receptors, but GIP receptors. However, Mounjaro, like Ozempic, also increases insulin production and blood sugar levels and improves blood sugar levels. Again, Mounjaro does increase insulin production by letting the pancreas know to make and release more insulin. It is important to know that GIP is another receptor that Ozempic does not affect. Mounjaro is also injected once a week. However, Mounjaro is started at a dosage of 2.5 milligrams for 4 weeks, and after that can increase gradually up until 15 milligrams at a max dosage. The benefits of Ozempic and Mounjaro. The benefits of Ozempic and Mounjaro are slightly different. However, similar benefits are the improvement of blood sugar levels in the human body, the low risk of hypoglycemia. There is a lower risk of having really low blood sugar levels. However, it is important to note that this is only when taken individually, not with any other form of medication, because then that risk factor does change. Another benefit that a lot of people think as a benefit, but truly is a side effect, is weight loss. However, they are different in benefits, such as Ozempic is able to reduce the risk of cardiovascular disease, meaning that it's able to decrease the probability of a heart stroke or a heart attack or stroke. Manjaro, on the other hand, increases insulin sensitivity. Now, again, Manjaro is able to do this because it affects two receptors. That GIP receptor and GLP-1 receptors are the reason why Manjaro is able to increase insulin sensitivity and Ozempic cannot. Manjaro also slows digestion and decreases appetite. Manjaro does slow digestion, which makes you feel full for longer, which therefore makes you not want to eat. The side effects of Ozempic and Manjaro are similar and different. The similar side effects are nausea, vomiting, and diarrhea. These are on the lower end of the side effects. However, it is important to know that every individual may have these to a different extent. However, Ozempic has the possibility of side effects of thyroid cancer and pancreatitis. It is important to note that Ozempic has these side effects. However, people with prior history of these two are more susceptible to these side effects. Now, that's not to say that if there's no history, it cannot happen. Manjaro, on the other hand, has side effects of constipation, indigestion, and stomach pain. Constipation, being unable to relieve bowel movements correctly, indigestion, heartburn, and stomach pain. Though these may seem a little bit less worrisome than Ozempic, it is also important to note that they can be at different levels and vary with each individual. Learning these side effects, benefits, and the usage and active ingredients leads us to be more informed. Now, why are these similarities and differences important? They are important because they allow us as individuals to make better informed decisions when it comes to our medical choices. It prevents us from being deceived by the mainstream media and allows us to weigh the pros and cons of each medication. It is also important to know that we should consult a primary doctor or medical professional for information on these two medications prior to beginning any use.